Welcome to Community Watch. And today we have an exciting conversation for some of you about Medicaid Part A, B, C, and D. So if you're getting close to 65 or you have someone that you love is getting close to 65, you're not going to want to miss this show. Stay tuned. Community Watch starts now.
Welcome to Community Watch. Greg, how are you?
I'm doing fine, Doc. How are you today?
Well, I'm all right. I am still impressed with that office of yours.
Hey, you join the right organization, we can get you one.
You keep it just immaculate. It's just amazing.
Hey, while you playing the show today, you need to pay closely attention to the show today.
Well, I see we have one of our favorite guests. Although he has not joined us in quite a while, it's great to see him, Mr. Sam Burrell. Welcome.
Good to be here. And I'm glad to know I've made it to the favorite status of you. Everybody doesn't make it there, you know.
That's true. You're correct there. But
everybody don't even make it back to the show.
Well, we're happy to have you with us, and I know that you have joined us in the past for a variety of reasons. And let's just get started with you talking a little bit about your motivation for joining us today.
Believe it or not, I'm going to try and keep this vague and open-ended, but I am an insurance carrier. I do Medicare Advantage plans, and I also do Medicare supplement plans. My reason for contacting both you and Greg was I have gotten tired of watching the commercials on television with Jimmy Walker and Joe Namath describing how you can get to a zero premium Medicare plan. And it's just, they're not giving the details of what it takes to get into one of those plans. They're not giving you the details of any of they give you the benefits, which is good, and that attracts everybody's attention, but they don't tell you the hoops and the things that you have to go through to get to one of those plans. And many of the plans that they are describing are not even conducive to your particular geographical region. They're not even in the area sometimes. So to me, to a degree, that is a bit of fraud, especially if they're not explaining to you what needs to be done and how you have to do it. They just want you to pick up the phone and call. And as soon as you pick up the phone and call, they've got a lot of people that will try and steer you in one particular direction.
Well, Sam, if you don't mind, because I've always been confused about this, exactly what is Medicare?
Okay, Medicare is an insurance policy that's given to us senior citizens by the Center for Medicare and Medicaid Services, CMS. There are two parts of Medicare. There's Medicare Part A, which pays for your hospitalization. And then there's Medicare Part B, which will help you with your outpatient services, outpatient surgery, doctor's visits, those kind of things. There's also parts of Medicare now that is not given by CMS, but it's given by private insurance companies. That's Medicare Part C and Medicare Part D. Now, this is a kind of a lengthy subject because there are a lot of different details that go in and out of it. And I'm not sure we can cover all of this in one segment. So you might have to invite me back again for another program. But anyway, one requires when you get 65 years old to apply for Medicare. I know you two aren't there yet. You've got a couple more years to go, I'm sure. When you apply for Medicare, you need to have Part A and B, which is the foundation of it all. You get that, you apply for that through CMS. those two parts of your Medicare will pay only 80% of your healthcare coverage going forward. So you will have to come up with a Part C and a Part D. And that's where private companies like the company I work for, we supply Part C and D. Medicare A and B will only cover, like I said, 80% of your healthcare coverages. Now, if you can do the math, if you go into, I do this one with my clients all the time. If you were to go into the hospital with only Medicare Part A and Medicare Part B, and say you accumulate a $50,000 bill, Medicare A and B will only pay 80% of that, which accumulates, which is equivalent to $40,000. That $10,000 of that $50,000 bill is coming to you. So you're going to have to come up with something that'll pay that. Now, unless you're Dr. Hershey and you got 10 grand in your pocket where you can just lay it out there like that, you'll be in good shape. But everybody's not like Dr. Hershey, you know, and we can't lay out 10 grand at one time for a hospital stay.
Just lay it down. Huh?
Some people can do that, you know.
Now, you know, because I hear about it all the time, and you hear about it, but really understanding what it is, and the importance of it. So now, is there any requirements for A and B? Like, is it an income restriction, or just you 65, you qualify?
That's a good point. No income restriction. Everybody, when they turn 65, can get A and B. You're eligible for A and B. I would suggest you, what if you're having a birthday this July and you're turning 65 in July, you need to apply for your Medicare A and B at least by April or by this month to have it available and ready for you for July the 1st. Because as of July, your card is always, your Medicare card will always be the first of one of the months. It's always going to initiate the first of your birthday month, I should say. That's a better way. So you need to apply at least 2 months out before your 65th birthday month. Again, let me say that again. If you're turning 65 in July, you need to apply for your Medicare Parts A and B in May or April of that same year, so that your effective date will be July 1 of your birthday month when you turn 65. That makes sense?
Yes.
Okay.
Yes, because I know with some other insurance, like on the health exchange, it starts the first of the month. I guess so. What's because you hear a lot of people talking about the prescription part, and I guess some of the trickiness of it. So what's, I guess, the big challenge with Medicare? Like, what is it that I guess a lot of seniors struggle with? Because it seems pretty straightforward with A and B.
It's quite confusing to a lot of people. It's quite confusing the way it's advertised, but in actuality, it's not, because either you have Medicare in and of itself, or you have Medicare with an Advantage plan, which covers that 20%, or you have Medicare with a supplement plan. Now, supplement plans and Advantage plans, they do the same thing, but they act a little bit differently. We'll get into those a little bit further into the details of it, because they're the supplement plan is a little more expensive. But let's stay with Medicare for just a while, because I want everybody in the listening audience to be sure about Medicare, because that's the foundation of your health insurance when you turn 65 going forward. To get Medicare A is going to be free to you. They're going to charge, the CMS will not charge you anything for that, because you worked hard. They figure that they can, I guess the government figures that you deserve this for being so long, and with the high rising prices of hospitalization these days and doctor's visits, they give you the Part A for free, which is the hospitalization. Now the Part B gets a little tricky, because on Part B, there is a fee that comes out of your retirement check or your private fee or your Social Security check, wherever. They're going to charge you a little bit for Medicare Part B. I think the going rate now is about $137 to $144 is what they charge you. Now they're not gonna, unless you're paying privately, they'll send you a bill if you're paying privately. If you're not paying privately, they'll take it out of your Social Security check, or they'll take it out of your retirement check, or wherever you deem it to that $137 a month or $137 a month, but it's coming out of a check somewhere. They have to be paid for you to continue that Medicare Part B. Now you're gonna have to, when you get into Medicare A and B, once you finally get that established, back during, this is, I hope your listening audience doesn't misunderstand me. This is not a political conversation. This is just what happened. Back during the Bush years, they passed the entitlement D plan. The D plan made it mandatory for you to take a prescription drug plan when you get Medicare Part A and B. So you have to have a prescription drug plan once you get Medicare Part A and B. If you do not take a prescription drug plan, they will penalize you all the way back to when you turn 65. So as an example, if you are 65, I don't need any prescription drug plan, I don't need a Part D because I don't take any medication. Well, you get 3 years down the road at 68, and you go to see Dr. Vinny Boombaza, and Dr. Vinny Boombaza says, okay, I'm gonna prescribe this medication for you. You're gonna have to take it. So this medication is kind of expensive, so you got to go to the Walgreens or wherever and pay for that medication. They're gonna say, okay, Dr. Vinny Boombaza sent this medication to you. You got to pay for it. How are you gonna pay for it? Well, I'm gonna have to pay for it cash. Well, that medication might cost you $1,000, and you got to take it once a month. So you don't have a prescription drug plan. So now you go to apply for a Part D at age 68 when you should have took it at 65. You apply for a prescription drug plan, and they penalize you for 3 years, all the way back to when you first got your Medicare Part A and B. And we're going to use this example in that July of this year. So you get 3 years of penalty. So it would behoove you, if you're going to get Medicare Part A and B, to also get a prescription drug plan. Are we good with this? Did I make it?
Yeah, no,
I tend to ramble a little bit, so I want to make sure that.
No, you said something. You said something. Then I don't know how much time we got. I know we're getting close to a break, but so really, you kind of trapped. Well, if you don't get it, because more than likely, if you keep on living, at some point, you're gonna need some kind of medication.
You guys are a little bit young to understand this, but yes, as you get into those 60s, there's going to be some kind of prescription coming at you somewhere. And I regretfully say that because I always prided myself on, I don't want to take his medicine, I don't want to take his medicine, but here's that rainy day, I'm here,
So now, how much roughly is a prescription plan? Because you're paying for the Part B, so then you got to pay an additional for the prescription plan?
That's exactly right. Now, this is where we start getting into Medicare Advantage plans, and this is where we start getting into supplement plans. Okay? You open that door, and that's why I called you, because this is not rocket science. It's kind of somewhat easy, but you got to know what you're doing once you get in the door. You can get a prescription drug plan, a freestanding prescription drug plan. If you do that, I've seen some cheaper ones out there for $25. Some of them are $30, but that's monthly. So you got to pay that monthly, and it will in turn subsidize your medication costs. But here's the caveat, and I'm gonna have to do this before the break is over, before the break starts. Here's the caveat. If you buy a freestanding prescription drug plan, you still have to come up with that 80%, that 20% that Medicare doesn't pay. So you can have a prescription drug plan, but you still got to find some mechanism to have that pay for that 20% of medical costs or healthcare costs going forward.
Wow.
Well, we need to take a break here, but I know there's a lot more to talk about. Do not go away.
I know you've had your moments of doubt and struggle, and I'm here to say I'm proud of you.
And although each one of us may take a different path, may we look back upon today as the moment we stepped into a larger world, a greater world.
You will pass this way but once. Do it right.
If ever there was a time to follow your passion and do something that matters to you, now is certainly that time.
Welcome back to Community Watch. We're having a conversation with Sam Burrell, who is an independent consultant with United Healthcare. Is that right?
That's correct.
Okay.
That's correct.
And Sam has been attempting to help us understand Medicare and the various supplements. And I have to say, I have enjoyed Greg's questions from his youthful advantage. I'm a little older than you might guess, and I've been through this, and I cannot tell you how badly I needed to talk to you 6 months ago, but it is too late now. But I did not listen hard enough when I needed to, and going through this was unbelievable to me. It was like it was like being dropped in a foreign country and having to know the language instantly. I was, and you are doing an excellent job of explaining simply the choices you have to make, but really the importance of this is so great that you really need more time with each individual to really get there, because some of the choices are automatic, but there's a lot of range. So you have to make choices based on what's best for you. And it's not an easy thing, and it's not something you can put off to the last minute, which I learned. And you haven't even mentioned yet the dental, vision, hearing plans if individuals need those. I know I need vision and dental, which if you get those, that can be extra as well, correct?
That's correct. Well, you hit that one right on the head, Dr. Hershey, because sometimes in this business you think it's just cookie cutter stuff, one plan to fit everybody, but everybody has different needs and everybody has different services that they might require for their health going forward. So it's not cookie cutter stuff. It's one pair of shoes doesn't fit everybody. Everybody's got different sizes and everybody's got different motivations for their healthcare going forward. The beauty to it is we are allowed to change, before we get into the details of Medicare Advantage versus supplement, we're allowed to change person's plans at certain times of the year. For example, if you are diabetic, you have congestive heart failure, or you are COPD, I can change your plan at any time of the year. Or if you have Medicaid, I can change your plan at any time of the year and get you something that will fit you better. If you don't fit into the diabetic, congestive heart failure, COPD, or Medicare realm, I have to basically wait until the annual enrollment period, which is going to be starting October. Now in October, if you notice, in October through December, you're going to see all kinds of bombardment, letters coming to your house. You're going to have people trying to sign you up for this on the phone. You're going to have people, commercials every day is going to be telling you 2 or 3 different things, because that's the annual enrollment period. And that's the time of the year where we know that everybody, regardless of what services you may or may not have, you can change at that time of the year. But you also can change at other times of the year, just to throw that one out there. And you can also sign up, you're in a grace period when you're first eligible for Medicare. So if we use that example earlier in this Zoom meeting, that if you sign up in July, I can sign you up in July. If your Medicare becomes eligible for July, I can sign you up in July. And then you still have a grace period if you don't like that particular plan, that I can change you in September. And then I can always change you again in October if you had a July date. But the more conveniently for everybody is the annual enrollment period that everybody is eligible for, no matter when your Medicare started. So don't feel like I don't want people to feel like you're always locked into a particular period or locked into a plan. You're not. You have options. It wouldn't be fair to the public if you didn't have options. So remember, Dr. Hirsch, going forward, if you don't like what you're in, I'm a phone call away or a Zoom meeting away. We can always look at it. Now, I always tell people doing my evaluation, let's look at what you have. Let's look at what you want. And let's look at what, if you have something better than what my company does, United Healthcare, I'll let you know. Because I'm not in the business, this is the social work part of me. I'm not in the business just to let United Healthcare pay me. I'm in the business to get you the best of what's out there. And in our area, we're a non-metropolitan area. There's not a whole lot of plans in our area. My territory encompasses all the way from the Chattanooga border all the way down to Harrison County. So there are not a whole lot of plans in that area because of the population, just because of the population. But I'll be glad I'll tell you, if you got something better than what we've got, I'll let you know. Now, in terms of what you said earlier, the benefits. Now, the benefits going to vary a little bit too. It depends on what plan you have, like the dental, the vision. They throw that out. Jimmy Walker and Joe Namath like to throw that out there at you and say, okay, you can get all of this, but no, you can't unless you have in the right plan. So,
Sam, I got a question since you said that. So do you honestly, so when someone turns 65, about to turn 65, who do they go to? Is there, so if I have a parent or somebody, even myself, but when you're hitting close to 65 and you need to sign up, is there a central place you go, or do you have to go to a company such as yours?
The first place, good question, Greg. The first place you need to go when you are about to turn 65 is to go to the Social Security website or get somebody on the phone and tell them that you want to apply for Medicare Part A and Medicare Part B. Now, let me throw something in there too. That's why I said we might have to do another segment because let me throw this one out there. If you're still working at age 65, and I'm running into this a lot in the field, if you're still working at 65 and you got healthcare coverage from your current employer, you can delay your enrolling in Medicare Part B as long as you have credible coverage from your employer. But once you drop the credible coverage from your employer, you're going to have to pick up Medicare Part B. Now, it's a little sticky in there, and you have to be careful with that. And then you're going to have to show Social Security that you had credible coverage. Say, okay, let's use this example. You're 65 years old. I'm still working. I'm going to work for XYZ Corporation. I plan on work till I'm 67, 68. So I'm going to keep my insurance with employee XYZ Corporation. But when I get to be 68, XYZ Corporation is going to drop me from their healthcare coverage because they know, this is going to sound funny, they know you're going to be more of a risk when you get to be 68 for health coverage. So they're going to drop you because you're going to be a pain in the royal, yeah, that one, right? So when they drop you, you're going to have to pick up some additional coverage. That's when you're going to have to come see somebody like me. Or you're going to have to, God, You're gonna have to show Social Security that you had credible coverage to age 60 to 68. So what I'm running into a lot in the field too is I'm beginning to see that the baby boomers, which I'm at the tail end of the baby boomers, once we get a lot of companies now, once you turn 65, they're dropping your coverage. Once you become Medicare eligible, a lot of XYZ corporations are dropping your coverage. They'll just say, okay, you got Medicare now, go get your own. And they don't say it as harshly as I just made that sound, but that's what they're doing now because they know you're more of a liability going forward. And the insurance company knows that too. So it's just the way it is, man. The insurance that our parents had, that they lived, that they had for the rest of their lives, those things are now rare. Once you start working for a company and they're going to insure you to your death, those are rare breeds now. I don't see I see more of the contrary than I see of that now. So if you're working, keep the coverage as long as you can, or sometimes it's more viable to cross over. So it just depends. But we started this train with go to the Social Security office before you turn 65, apply for Medicare Part A and Medicare Part B.
Mm-hmm.
Well, Sam, I know that the one if people hear nothing else from you today, they need to know that I would say around the age 64, they need to start doing a little research.
Agreed.
And be ready rather than wait till the last minute, because it's too much to try to take in and get done at the last minute.
You're going to get the thing that's so confusing sometimes and so perplexing to a degree is there's so much stuff coming at seniors now. I mean, you get hit from all directions. Social Security is sending you stuff. You're getting stuff from all kinds of private contractors that are doing. Social media, you turn on that, the people coming at you telling you, get this plan, get that plan, get an Advantage plan. And see, we haven't even talked about the differences between an Advantage plan and a supplement plan. So,
We'll get you back.
That
ain't no problem.
That's the lead to the next segment, the next time y'all invite me back or vice versa. So then we'll get into that one because there's differences there too. I mean, it depends on what shoe size you wear, basically.
Now, Sam, I know years before you would come onto the show with the senior forum.
Yeah.
And I know they had a lot of information out for seniors. Do Rome no longer, do we still do that, or is it no longer done?
Yeah, you're asking some great questions. Your timing is right on point, Greg. We just had a meeting this past Thursday, the Senior Advisory Committee. We decided that it was kind of close, so the Senior Forum should come back on cycle next May, because we had that spot in May was kind of our annual point of having it. So yeah, we're going to come back on with the group decided this coming May. And then there's some other senior events coming up in the fall. So stay tuned for that.
Well, Sam, before we run out of time, please give us some contact information for folks who want to contact you about this.
Okay, I'll be glad to. And I'm looking forward to coming back. My name is Samuel Burrell. I'm an independent contractor for United Healthcare. My phone number is 706-506-9829. And my email is seniorhc123@Yahoo. It's seniorhc123@yahoo.com.
Telling your age with that Yahoo.
Still relevant to me, Greg.
Thank you. Thank you for talking about this with us. We definitely will have you back.
Thank you. Appreciate it. Good to see both of y'all again, man.
You too. Thank you, sir.
Okay.
And thank you for being with us on Community Watch this week. We'll see everyone next time.